Welcome and welcome back to the channel. My name is Jackie. I'm a dental student and today I'm going to share this oral hygiene routine. It's very basic and very simple, and I promise you, you will have less dental visits in a year if you stick to this routine. And I'll also have 3 simple tips at the end of this video as well. Your mouth has its own natural bacteria, good bacteria, and when you start eating, you're incorporating bad bacteria into your body. Bacteria that causes cavity, the bacteria that eats away at your enamel and starts getting down, and that's how cavities are built. But we're not going to go into the details of cavities here. We're just talking about the why and the how do we prevent it, okay? That's why we want to brush our teeth both in the morning and at night, especially at night, because at night when your mouth is closed, hopefully your mouth is closed even if you're snoring, when your mouth is closed for a long period of time, it's dark and it's wet, and that is the perfect environment for bacteria to grow and multiply in. And especially if you just finished eating some chocolate, even bread, even strawberries, because there's sugar in strawberries. If you go to bed and you just finished eating that, you didn't brush your teeth, and then now you're sleeping, your mouth's closed, your mouth is moist, it's dark, bacteria is gonna start multiplying and eating away at your teeth, and that's how cavities can start to develop. However, if we brush our teeth before we go to bed, we eliminate that problem. And then brush our teeth in the morning after we wake up. That's gonna put us at a higher advantage to prevent those teeth-eating bacteria. I like to use mouthwash first before I do anything. I feel like mouthwash just overall preps your mouth before the floss, before the brushing, before all of that. It's always important to use a mouthwash that actually has anti-cavity or anti-gingivitis benefits. A popular mouthwash, I'll put it here, that people use, and this actually has no oral health benefits. It only helps with your breath, which is not a bad thing. However, if you want to take into your overall oral health, I would recommend that you use it with another mouthwash. So you don't use it on its own because it only helps the breath. It won't help any plaque, it won't help any gingivitis, and it won't help with any cavities. So you want to make sure that the mouthwash you're using has some type of dental health benefit. I prefer to use Listerine. Listerine is like that staple brand for me. Also, Crest is good, and I'll have some other recommendations below. However, I'm using Listerine because it's antiseptic, so I know it's doing what it needs to do with that bacteria, and I just prefer it. Listerine also has a non-alcohol version if you don't like that sting, but you want to make sure that the mouthwash you're using has some type of dental benefit. So when I say dental benefit, you want to see in the active ingredient. The active ingredient, you want to see something, and then you want to see that the purpose. So the purpose for it. So here, this is HEB brand, alcohol free. I don't like this one at all. I can't say that I recommend this because it does not have an ADA band, or not ADA acceptable, but it does say that it has some type of this. Listerine is my go-to. It's just a staple for me. As you can see, it's ADA accepted, and this is what we want. If you're gonna put anything in your mouth, come closer. If you're gonna put anything in your mouth, make sure it is ADA accepted. ADA is the American Dental Association, and that is the people that just anything that has to do with dentistry, dental, they go through that. They got all the information for that. So you want this. Make sure it has ADA. Okay? Check the active ingredients here, and then check the purpose. You can see the active ingredients here, like menthol, thymol, eucalyptol, and the purpose is anti-plaque, anti-gingivitis. So this is what you want. When it comes to brushing, you want to brush it at a 45-degree angle. You can use either a regular toothbrush or an electrical toothbrush. They both have the same effect. However, I prefer an electrical toothbrush because I feel like I don't have to do much with my hands, and I feel like I can get a better clean with it. However, both of them have been proven to be very effective. For your toothpaste, you want to make sure your toothpaste has fluoride in it. I know there's a lot of people out here not wanting to use fluoride toothpaste because they they feel like it harms you, but trust me, the amount of fluoride in the toothpaste will not harm you. You want fluoride in your toothpaste because fluoride is what is going to help remineralize your teeth. And what that means is that if, let's say, bacteria did break down your enamel, that fluoride is going to help remineralize it so it doesn't continue, and also it can prevent your teeth being broken down by the bacteria, which is why we emphasize brushing morning and night. I prefer to use Sensodyne because I have sensitive teeth, but Colgate, Crest, there's so many good brands out there. You don't have to spend an arm and a leg on toothpaste. I know there's a thing going on with charcoal toothpaste. I can't say I recommend charcoal for a toothpaste because charcoal is very abrasive and it's a little bit too harsh on your teeth. So your teeth are going to be more sensitive and more prone to being stained. So that's something that you may want to look into staying away from, and just stick to the regular mint toothpaste. Okay, let's not bring charcoal into this. Maybe bubblegum toothpaste, but let's just stick to the regular and get away from charcoal. Alrighty. And we can't just stop there. We want to also floss. When we floss, we are getting rid of the bacteria in between the teeth. It doesn't matter if you're using a electrical toothbrush or manual toothbrush. It's rare that a toothbrush is going to be able to get into the crevices of your teeth, which is where bacteria and food can get trapped in as well. That's why we stress the importance of flossing, because it allows us to get rid of that area, and we like to call that area the coal. So when you floss, it's like brushing in between your teeth, and there's several different types of floss you can use. You can use a string floss, a hand pick, or water floss, but I think the good old floss, like string floss, works really good, and it's so cheap to get. But y'all, when I tell you, flossing can really take your oral hygiene to the next level. Don't sleep on it. Do not sleep on it. Tongue scraping, this is how you really eliminate bad breath, on top of mouthwash and brushing your teeth, of course. But this just scrapes your tongue of the bacteria, y'all. And there's multiple types of tongue scrapers. You don't have to be particular on which one. They're pretty cheap to get, and any of them, it's not something that one works better than the other. It's all about a preference. Find one that you like, stick to it, and use it. Make sure you scrub your tongue very well morning and night. Now that we've mouthwashed, we've flossed, we've scraped our tongue, we've brushed our teeth morning and night, we've done all preventative stuff, let's talk about the aesthetics. Everybody wants that pearly white teeth, y'all. Like, teeth whitening companies are making an arm and leg. White teeth can literally transform your smile. Walk into the room and you smile, you can literally light up the whole room, y'all. I have been whitening my teeth for so long, and I've gone through so many methods, and then now being in dental school, seeing how to properly whiten and how to effectively maintain white teeth is something that I've learned, and I'm excited to tell you guys about and show y'all. There's so many different methods to whitening your teeth. You can use strips, you can use additives to your toothpaste, you can use a gel, you can use a teeth whitening system. So many methods to use. Just find one that you can be consistent with, both in the price and the method of how to use. I prefer to use the whitening strips because I can just put them on and go about my day versus any of the other ones. Also remember that whitening can make you more prone to sensitivity, which is why I do have sensitive teeth. So that's also a thing, which is why I would recommend getting a potassium nitrate. Potassium nitrate helps with sensitivity. It's dental, I think it's a dental tubule blocker. Like I really learned in school. Potassium nitrate is a dental tubule blocker, so it blocks like the little holes in your teeth. Like, think of your teeth like it's a sponge, and then when it's whitened, it's like the holes in the sponge are exposed. So what potassium nitrate is, it'll close those pores, or like kind of like make it less sensitive. Potassium nitrate is one thing that I like to use if I'm whitening a lot and my teeth are becoming really sensitive. You can also use potassium nitrate maybe like if you accidentally sleep in your whitening strips, like I did before. I slept in my whitening strips, y'all. I had the worst sensitivity ever. I had to put like potassium nitrate all over it. You can put it in a tray or you can put it directly on your mouth, but just make sure to but kind of hold your breath so that it's on your tooth and not on your inside your mouth. There's so many different whitening options. If y'all want an in-depth video on how to use the other ones, or just like a breakthrough comparison of the other whitening methods, I'll be happy to do a video on that. But pretty much that's it. Like, you don't need to do too much when it comes to your mouth. Just keep it simple and be consistent. Alright, so I know I promised y'all 3 tips on how to enhance and take your oral hygiene to the next level, and I am a woman of my word, so without further ado, let's get into it. So my first tip that I have, it is a little bit biased, I won't lie. My first tip that I have to take your oral hygiene to the next level is to go to the dentist twice a year or every 6 months. And I say this because even though you're doing all what you need to do, I hope you're doing all your oral hygiene, you're being consistent, you're doing a good job brushing, and you're doing a good job brushing twice a day, flossing, you whiten safely, you're scraping your tongue, taking care of your mouth, whatever. You need to go to the dentist just to get an oral health checkup, because for cleaning, they use a different level equipment that's gonna really clean your teeth and just clean below like your gums to where your toothbrush cannot reach, and that will really take your oral hygiene to a next level. When a dentist does your cleaning, you cannot compare it even with an electric toothbrush. Trust me, you do not want to miss out on your biannual dental visit. And also, when you go to the dentist twice a year, you can ask them to put topical fluoride on you, or to see if you're a good candidate for topical fluoride. And what topical fluoride does, it just really makes seals and protects your teeth from developing cavities. If you do have cavities, it'll help seize and arrest those cavities so they don't get worse and they don't start to cavitate and you don't have a really big hole in your tooth. Along with fluoride, your dentist may or may not recommend having sealants on you. They do this a lot for kids, but honestly, anyone is a good candidate. I have some, all my molars have a sealant on them. What that sealant does is that it just prevents food from being stuck in my molars, because you know your molars are really groovy and have a lot of crevices in them. So when you eat, stuff can get stuck in them. But when you have a sealant, it just makes it less groovy, so that when you eat, it still makes it a smooth and slide surface for food. So that is probably a game changer in cavities, and I probably will not have a cavity again because I got that and I know how to take care of myself. My second step is about whitening. So this is for my coffee drinkers. If you drink a lot of coffees, teas, a lot of drinks that aren't water, make sure you're using a straw so that it's not touching your teeth. And even on top of that, make sure you rinse your mouth with water after drinking anything that's not water. Trust me, it will really help prevent the stains from coming, and you will not have to whiten your teeth as often as you think you would. Even after eating, just a quick swish with water, trust me, it'll go a long way. And then my third step is gonna be the hardest one to break to y'all, because when we learned this in class, I was like, what are you talking about? What do you mean I can't snack all day? What do you mean? Snacking all day really puts you at a risk cavities, of having more cavities. And not just snacking, it's what you're snacking. If you snack on foods that are very retentive and sticky, and let's say you eat lunch at 12, you eat something really sticky, some caramel toffee, but you don't go to bed till like midnight. That's literally 12 hours, about 10, 12 hours that toffee has had to attract bacteria to break down your teeth. You're repeatedly eating throughout the day, you eat chips and you eat something, then I don't even know what snacks are anymore. But I say this to say that I'm not saying you can't eat those things, but when you eat them, make sure you get it out of your teeth and make sure that you rinse your mouth with water. And also, you can pair your foods together. Let's say if you eat something really sticky, if you eat a fruit or a vegetable after it to wash away that stickiness, you can do that. And also, it goes back to the drinking. When you want to drink something like a Coke or soda, when you want to drink it, don't drink it on its own, drink it with a meal. That can definitely help you reduce your caries risk. Just try not to snack too often. When you want to snack, have it with a meal, and don't just be eating, because when you're constantly just eating, your mouth does not have enough time to produce saliva to remineralize your oral flora and to just wipe off that bacteria. Your mouth doesn't have time to do that when you're constantly eating, constantly introducing new bacteria into your mouth. It's like, we need a break. And when I learned that in class, I felt like they was coming for me. I really did feel like they were coming for me. I was like, I love snacking. What do you mean? but just try to remember to pair it with a fruit or a vegetable to wash down the if it's a sticky or retentive food, to wash it away, just to make sure that your mouth is not constantly having to go through that introduction of bacteria. Thank you guys so much for watching. I really tried not to make it seem like I was just regurgitating a lecture that we had, but I really wanted to make sure I was informative yet still relatable, because trust me, I get it, I understand. I hope you found this video useful. Let me know what other videos you'd like to see on this channel. Don't forget to like, comment, suggestions, tips, anything, and of course don't forget to subscribe, and I'll see you guys in another video.